Hi, I'm Patrick Terry, and I'd like to speak today about evidence generation in health economics and why that's important. And I think, generally speaking, the level of sophistication and activity in Washington and in policymakers and at the federal level, and the realization, the challenges of sustainability of healthcare in the United States, and the overall percentage of gross domestic product that will be spent on healthcare. It was recently projected that we will exceed 20% of our GDP in the next 15 years in healthcare. And that's subsequent to the Affordable Care Act and the federal health policy reform and healthcare reform that was intended to bend the curve and reduce the overall federal spend in healthcare. But ultimately, as we increase eligibility of an aging population, the dilemma of sustainability will loom large. And policymakers and federal agencies will try to deal with these circumstances by increasing thresholds of evidence, increasing the level of bureaucracy for coverage and payment for products in healthcare, and present significant challenges for product developers and innovators in healthcare. And putting a set of requirements in front of healthcare product developers that have not existed before. The challenges of demonstrating real-world effectiveness, utility evidence, patient outcome evidence, health economic ramifications, identifying a chain of custody of influence of a new product introduction in a very complex delivery matrix. So these challenges are ultimately before us, in front of each product developer. Understanding how to navigate these issues are important. There are a series of reports coming out of the Institute of Medicine that need to be reviewed and understood about generation and demonstration of evidence around personalized medicine products. That should be well understood by developers. Because inherently in these increasing evidence demands will be expensive requirements. They will be non-regulatory challenges. Ultimately, navigating the regulatory landscape is inherently burdensome, but nonetheless, the evidence requirements, clinical effectiveness, comparative effectiveness, these additional enterprise requirements will be important for developers to understand. And at Scientia, we're looking at these things. We're trying to understand and map these things, understanding the life cycle of policy making. What does it mean for developers? And we set up a series of blogs and try to highlight our current thinking about some of these emerging and interesting challenges facing product developers. We'd welcome your comments, and we'd certainly like to keep a dialogue open around evidence generation, cost effectiveness analysis, clinical utility demonstration. We'll try to communicate what we're doing in that regard here at Scientia Advisors, and we look forward to your comments and your feedback, and thank you for listening.